All right. Thank you all so much for joining Black Millennials for Flint this evening. We hope that you have a good libation to wrap up a really good week. It's been really exciting to see our 2020-21 Lead Prevention Ambassadors really put together some phenomenal programming, especially in this virtual space. And so this evening, we have the opportunity to speak with leaders in the field, especially as it relates to environmental justice, and ways to just make sure that our planet is safe and clean for us, for our children, and our children's children. So really looking forward to a really robust conversation. And so with that, I'm going to transition by introducing our moderator for this evening, Mr. Joseph Pettigrew. He is a 2021 Black Millennials for Flint Lead Prevention Ambassador. He is a Flint native and just an amazing, young, and vibrant leader, specifically in his hometown of Flint, Michigan. So welcome, Joe Pettigrew.
Thank you. And I'm glad to be here with you guys today. I think this is definitely a timely conversation that we need to have around environmental justice, especially, what we see going on in the Trump administration and, on the local and state levels around the country. So I think, I'm excited to be with you guys, and I'm happy to engage with you all today. And I'm looking forward to what you all have to say today as well, too. All right, so we can start off with introductions.
Awesome. I'll kick it off. Hi, I'm Jamal Lewis. I'm with the Green and Healthy Homes Initiative. I'm a senior policy and technical assistance specialist with GHHI. And my role with GHHI is to advance lead poisoning prevention and energy efficiency and other healthy housing policies and programs across the country. And so one of the pleasures I've had is working with Latricia and Black Millennials for Flint to help to advance lead poisoning prevention. It's a really serious issue that impacts a lot of our communities, and happy to be connected to Latricia and Black Millennials for Flint, and I'm happy to be here today. And I would be remiss to say that my colleagues at GHHI, in particular, Ruth Ann Norton, who's a huge fan of Black Millennials for Flint, also say hi.
Thank you. Thank you. I'm glad you guys are here and in support of this conversation today.
So I'll do introductions next. Thank you to our gracious hosts for inviting me here today. My name is Mackenzie Mathews. I work in the District of Columbia government in the Department of Energy and Environment. We just finished a year one of a brand new lead pipe replacement program. And I am extremely excited to kind of share with you guys what we've been doing in the District of Columbia. The program was created as a response to environmental racism and environmental injustice in the mid-2000s here in the district. So I'm really excited to share some of that information with you guys and answer any questions you have about our programs.
Thank you. Thank you. Thanks for those introductions. And I think, we can, jump right into this conversation. And I just want to ask you guys specifically kind of the work that you guys been doing pre-COVID and then post-COVID. What are some things that you have been doing in your field? And then also, how have you been navigating the space of COVID, and to, really educate people and let people understand, the impact of lead poisoning, but also other environmental justice injustices in our country.
Yeah, I guess I'll start. So just to, you wanted to start from pre-COVID. Seems like such a long time ago.
Right. Yeah.
But yeah, we like I said, our organization has a long history of advocating for lead poisoning prevention. We started off in 1986 as Parents Against Lead, and our our CEO, President CEO Ruth Ann Norton, was crucial in implementing policies and putting in place programs for the state of Maryland that has led to a 98% reduction in lead poisoning prevention cases, or sorry, lead poisoning cases in the state. And so a lot of our work is built on that success and wanting us to get to 100%, and also wanting to bring that success to other parts of the country. And so one of the ways in which one of the places which we're doing that is, or was in the state of in New Jersey, where we have worked, and I've worked specifically for the last 3 years to coordinate the Lead and Water Coalition with the lead based paint coalition. One thing that we see often is those two factions operate pretty in a silo, and maybe Mackenzie can speak to that a little bit as well. But in New Jersey, there was a similar issue to the one that happened in Flint, where there was a lead and water crisis, where parts of Newark, parts of that city, was exposed to elevated levels of lead and water. And it is not a shock to me that the people that were exposed happened to be people that predominantly looked like me. And so that incident led to a lot of advocacy, a lot of successful advocacy to put in place a lead pipe replacement program. But one of the things that we know is one of the the primary source of lead exposure actually isn't water, but it's paint. And so the fact that there was so much advocacy for this water issue was really good, but it highlighted a need for there to be more coordination amongst the lead and water crowd and folks who were advocating to eliminate and remediate lead-based paint in residential housing. So we've started working with partners like New Jersey Future and Isles, who I know Latricia knows well, to do just that, to come up with a statewide advocacy plan that, one, addresses lead-based paint hazards and also pairs that with the replacement of lead service lines. So that is one of the efforts that we have been working on. And I'll just highlight one other one, and I'll kick it to Mackenzie, which is working with a group of partners in 9 states to help advance and improve their childhood lead poisoning prevention programs, which are funded by the Centers for Disease Control and Prevention. And this effort was a part of a collaborative approach called the Collaborative Innovation Network, otherwise known as the COIN. And the idea was to get 9 states together, 9 lead programs together, to talk about some of the challenges that they're facing, and to have some organizations, national organizations, available to provide technical assistance to those organizations, or to those lead programs. And so GHI was involved in that, have been involved in that for about 2 years. And that program actually is just wrapping up. And so it was a really powerful and important initiative that was co-led by the Association for Maternal and Child Health Programs, and co-led by the National Institute for Child Health Quality. So GHI, we were involved in that and helped to help the lead programs to put in place best practices to maximize the impact of their lead screening programs, to work with code enforcement officials to identify lead and funnel those families into actual remediation programs, and we did a few other things. But I will stop there, and I'll kick it to Mackenzie to hear about the great work that's happening in DC.
Jamal, I thought it was funny you mentioned the silo between people who do like the lead and paint, the lead and water, and spot on. I think that's been my experience as well. I am part of the lead and water crowd, so I'll focus on what we've been doing and then how it's been impacted by COVID. So in the District of Columbia, we also had a lead crisis in the mid-2000s. They changed where drinking water was sourced from. As a result, there were multiple cases of children and families with exceeded blood lead level cases. And the water utility here in DC was required to do replacements. As I'm sure a lot of you guys know, the service line that connects from the street to the house is half owned by the utility and half legally owned by the private property owner. So the decision was that the replacement of that full service line was not the responsibility of the water utility. So when they were mandated to do these replacements, they said, we're going to replace the public side. The remaining private side, you know, come knock on your door. It's like, if you have $2,000 right now, we'll replace the whole thing, but otherwise we'll replace half and go. Not so surprisingly, there is a strong history of wealth inequality and racial segregation here in the District of Columbia. So the people who were not able then to just have $2,000 on hand got a partial lead service line replacement. And that partial lead service line replacement can cause a pretty severe short-term spike in lead in water. And so the program that we work on is specifically to address those past partials and to prevent any from going forward. So there are kind of two programs that are funded from the District of Columbia. Whenever the water utility does replacements in the public side, we'll pay for the private side on behalf of that property owner. And then any ones that occurred in the past, those property owners can apply to us, and we will pay for, regardless of their income, at least half of the cost to complete that replacement, up to 100% based on their household size and income. So that is a way that we're addressing that. That funding and this legislation became live on October 1, 2019. So right in the middle of year one is when the COVID pandemic happened for us. So of course we were very nervous because we were so excited to get this off the ground, and we've had a lot of interest from homeowners once they become aware of lead hazards in their property who want to remove it, understandably. But fortunately, we've not had to pause operations in any kind of meaningful way in order to keep things going. And that's entirely because these replacements occur on your front lawn, basically. So we're able to keep 6 feet apart, mask required, and have kind of these safety mechanisms in place to ensure that it's not a mechanism for spreading COVID, which we certainly don't want.
Absolutely. All right. Thank you. Thank you for those answers. And then I also want to kind of like piggyback off this first question. You know, working in the field of lead exposure in the water, lead in water, and then also lead-based paint. How do you guys go about educating the public and being aware of the risk factors?
I can speak to that, Joe. So one of the things that we do, and this is a perfect connection here, with Black Millennials for Flint, since we are very much so grassroots, we partner with larger, more legacy organizations in order to amplify messaging. Because we have a target of the like Gen Z millennial bracket, we also take into consideration marketing and what actually is best conveyed to a younger audience. So of course, social media is an incredible tool. I refer to myself as a seasoned millennial. So for example, I know that I need to get more hip with TikTok, for example. There are young people that I've had the pleasure of working with that have, I mean, mind-blowing reach, like Leah Thomas, the young lady that's coined for coming up with the concept of intersectional environmentalism. I think about this other beautiful young lady out in California. Her name on social media is Climate Diva, for example. So there are all sorts of ways to engage, but then make sure that that information is digestible. And I think with me leading this organization, with not being an environmentalist by trade. So I'm looking at Jamal and Mackenzie, where they have this rich technical background, because I have no choice but to make sure that it's broken down in the way that I understood it. And it also gives me space to empathize with those folks who I'm trying to, or the organization is trying to engage with.
Absolutely. Yes, I agree. I definitely think that, the information needs to be digestible, because sometimes, we see organizations who have a plethora of information and nobody knows like what the heck is actually, what it's actually saying. So I think that's, very important in using social media. I'm a millennial as well too, not seasoned, but I'm a millennial. But I think it's, definitely important to use social media to raise awareness, but also engage people. I think that's where it comes into play is, after we raise awareness, how do we engage people to, be a part of the conversation and not just sit on the sideline. So I think that was definitely an important issue that you raised, Latricia. So my next question moving forward. So Jamal, you talked about actually promoting challenging policies. So policies that are in place that put Black and brown people in a position where they're more prone to lead exposure, and implementing more programs and more policies through lead prevention and lead eradication once it has entered the body. Because we know that, once it does enter the body, there are remediation programs and efforts that you can use, like the things you eat, exercise, your diet, and things of that nature. So if you both, and either one of you can go first, just talk about those policies, even if it's on like a local level or a state level or national level. I know there's some work you're doing in New Jersey. So could you kind of just kind of expound on that a little bit for me, Jamal?
Yeah, absolutely. The one thing that I'm sure has been echoed throughout the week, of your events, is the fact that the only way to prevent lead is to eliminate exposure. And so the policies that we promote are to make sure that there are enough resources available for remediation. We know the problem, we know the issue, we know where, which homes are likely to have lead-based paint. We know who's living in them. We know which housing is likely to be connected to lead service lines. But what we don't have is the resources right now to address it. And so the biggest action and policy action that we are promoting is raising resources for remediation. The largest resource available right now is the HUD Lead Hazard Control Grant Program, which, despite all of the other issues that this administration has had as it relates to the environment, one thing that has been positive is the fact that they've increased the level of resources for lead remediation. We're at a historic $290 million available, and these are really, really critical resources for communities. But one thing that we're finding is that HUD grants can be really extensive, and they can require a lot of resources to implement. And so a lot of smaller jurisdictions aren't in a position to be able to administer and actually reach the level of units that they need to reach. And when I say units, I mean just households, where they would remediate lead. So one of the things that we also do is provide technical assistance to jurisdictions, and I'll just talk about one, which is the city of Lancaster in Pennsylvania. And a funny story, I actually started my career in environmental health in Lancaster, Pennsylvania, doing research on lead. So the fact that right now I'm working to help them implement their HUD lead grant almost seems full circle for me. So it's a really cool experience. But they are a relatively small city in Pennsylvania that is very diverse, but also very very rightly ambitious. Their mayor was elected and decided to go for HUD's high impact lead grant, and essentially was the smallest jurisdiction to apply, and proposed the most amount of units of all of the jurisdictions that applied, got the grant, and is now looking to implement that. So it just goes to show you that, I mean, sometimes all it takes is someone to believe that this can be done, and someone in the right position to believe that this can be done, and it takes that level of investment and support to be able to address this really harmful issue. So overall, I mean, that's the primary thing that we primary policy that we promote. But I'll just talk about another one, which is a proactive rental inspection, which is something that the state of Maryland has on a statewide basis. But what it does is it takes the responsibility away from tenants. It prevents us from having to detect lead through children, which is harmful and unjust, to have a child be poisoned in order to know that there's lead there. And so what a proactive rental inspection program is in the way it works in Maryland is every 3 years, a property owner has to test their lead, test their property for lead in order to actually receive a rental certificate to be able to rent their property out. And so it's a really important tool, and it's because turnover happens occasionally. This is a great way to detect lead hazards before they have the chance to poison the child. That's something that I believe every state should have, and sadly only the state of Maryland has it. There are a couple of cities that have it. That is and actually the city of Pennsylvania. The city of Philadelphia in Pennsylvania, and my heart goes out to them for what they're dealing with right now. But they do have a proactive rental inspection program that's going to protect all of the kids in Philadelphia. So if there's two things that you folks out here who are listening can advocate for, is more resources. So you can call your members of Congress to let them know that we need more resources to address this issue, and also to call your state reps or your city reps and let them know that they need to pass a proactive rental inspection, or they need to put in place a rental inspection program to take the responsibility away from tenants and put it on property owners to keep children safe.
Absolutely. It is funny that you mentioned that, because Flint, the city of Flint where I live, they just passed an ordinance just like that. And it's they had it back in, I want to say 2008 is when it first was originally adopted, but in 2016 they got rid of it. So we've been out of it, a ordinance for almost 4 or 5 years now, without any protocol, any accountability, really. And that's what a lot of times we are dealing with, the lack of accountability to actually, once these plans are put in place, the accountability portion isn't there. So I think, that is definitely a great thing to have, a great concept that every state needs. And I wish that we see something like that going forward. Whoever becomes president in the next 4 or 5 days, actually advocate for that, because before I was a lead prevention ambassador, I didn't know anything about lead, even though I lived in the city of Flint and I've heard about the water crisis and things like that. I knew about it, but I wasn't like really in the trenches, sort of say. I wasn't in the trenches, really really learning about the information and how it impacts people until, I started, this program about a month ago. And it's like, wow, like I did not know, this much can impact a person. And now, the things that I see in like kids, I'm like, wow, this could have, this could correlate in a way. And many people don't know. They just don't know. So Mackenzie, I want to really pose a question for you as well too. in terms of policy making or program implementation? What are some things you and your organization are doing to not just have lead eradication, but also remediation efforts as well too, once people are exposed to this toxic?
Absolutely. So as Jamal was talking, I was thinking of two things. One is information has been really important. Just knowing that you may have a lead hazard has been really important. Just recently, we kind of beefed up our disclosure laws. So if you're going to sell a property or rent a property, there's more requirements before that you can make that sale, so that the person who's kind of entering into that lease or to that receiving that deed is aware of kind of what they're getting into. So that's really important. Another thing that's important is we have our water utility, I can't take credit, it's like dcwater.com/leadmap. You can search any address in the district and you can see what kind of records they have for that property. And it's like a really kind of attractive color-coded GIS map. And knowing is kind of the first step to making any kind of action at all, because you do more than anything want to get in front of something before it's occurred. And that information to know that there is a hazard present has been really critical. But if we're on the other side of this and somebody has already been exposed to a lead hazard, I think something that's been valuable for us is partnership and making sure there's kind of a pipeline between healthcare to, we also received very recently the HUD lead grant. And so trying to build a pipeline between, there's a case of an elevated blood lead level. Okay, well, let's connect the right people in the right industries instead of having these silos, like we said earlier, and get them to the ability to encapsulate or abate that lead contaminant through something like the HUD grant, which has given us kind of the resources to do it.
Absolutely, absolutely. Yes,
I want to.
Oh, you can go ahead. Go ahead.
Yeah. I just want to echo and underscore and underline that the disclosure, because that is a really good policy. For those who don't know, it is required under the lead and copper rule, which is the HUD rule, for any property owner to disclose the presence of lead-based paint hazards or any lead hazards that they know of. And so the loophole is that many property owners will claim that they don't know, and they may not know also, and that precludes them from disclosing any lead hazards. So it's a way of maintaining the fact that there may be lead hazards in the property without doing anything about it. So the fact that DC has, and I'm actually located in DC, and so the fact that DC has that is a really powerful tool for identifying lead and being able to do something about it. So I appreciate you sharing that, Mackenzie.
No one escapes.
Absolutely. So kind of piggyback off what you just said, Jamal, how do people get that information? Say they're in an apartment complex or they're in a home that they're renting. How do people get access to that information, knowing that, they can be point positive sure that no lead exists in their home whatsoever, if it's water or if it's lead-based paint? What are like some steps people can take to ensure that their loved ones and their cells are safe from this lead exposure?
Well, the first thing that I would recommend is for any family that has children to just make sure you get your child tested, because that is unfortunately that is a way of knowing whether your home is whether there is lead exposure in your home. And so for anyone watching who has a child at home, it's particularly a child under the age of 2, I would really recommend that you take your child to get tested. That's really important. But the second point is checking with your local health department and your local housing department. There are some really great resources that are available through both departments. And and developing a relationship with those entities are really important for getting information and finding out where potential lead hazards might be in your area. So those are two ways in which people can get information. The last thing is actually something that I'll target to health departments. So any health department that is watching or maybe tuning in, to make sure to meet people where they are. And so one of the issues that I've noticed in the work is that some communities are deemed hard to reach, which in my mind really just means a lot of times in my mind this means that there isn't enough effort being put to meet communities where they are, and so and so that's a really important thing, because those communities that often are deemed hard to reach are disadvantaged communities, communities of color, low-income communities that where the risk is that much higher for exposure to lead. So for any health departments or housing departments that are out there and maybe watching, I would really encourage you all to do the work to try to reach those communities. And you don't have to do it yourself. And I love what Mackenzie said about partnerships. There are local community organizations in those communities that you can partner with to share information. There's faith-based organizations, there are other environmental organizations, workforce development programs that you can partner with to get the information out there about lead and about lead exposure. So those would be the 3 tips that I would highlight. And I know, and I figure Mackenzie has, and Latricia also have other ways of getting that information out there.
Yeah, so I'll just quickly speak to that around strategy, specifically around community outreach. I think what happens a lot of time is people are not able to delineate or determine the difference between community service versus community outreach. With community outreach, it does very much so include strategic communication. One of the things that I think that Black Millennials for Flint does really well is to really, of course, like during COVID, that has been difficult, but we really pride ourselves in canvassing, especially with engaging with Black and Latinx communities. Just the culture is very much so close-knit. And then I'll use our experience in Flint, for example. There are major trust issues with people who can be perceived as being associated with the government, whether it's local, state, federal. And so there's an art and science of engagement, right? So that people are open to receive information and actually find it to be credible. So, and a lot of the work that we do with our Lead Prevention Ambassador program pre-COVID is we really focus a lot on establishing that trust within the community, and then also being consistent. So another issue that I see is that you can't just like give out like a flyer or a pamphlet and be like, all right, I reached the community, I gave this information. It has to be consistent. So that looks like, for example, we do we have a signature canvassing event that takes place during Women's History Month with a focus on reproductive justice. It happens every year in Ward 7 and Ward 8 in DC every single year. And some people we see again and again, but is to reinforce that information, to provide folks with new updates, especially on policy. We all know from our experience, the accessibility to policy just from a cognitive perspective, because it's so technical, requires a lot of input from a community outreach perspective. So whereas we depend heavily on the technical information and knowledge that comes from our scientists, Trust Science, our other research-based organizations, our government agencies, what we do on our end is, again, just translate that to get people to understand, but then also empowering people with providing information on how to hold people accountable. That's the part that really makes the difference. You can have the most pristine policies in place, but if they're not being implemented with fidelity, then it's kind of like moot at that point. So I'll stop there.
Yeah, just to jump in on that too. One thing I was thinking about was the inventory that we have is one like major way to let people know for us to do that community outreach is almost cheating, because we do have, because it was pretty recent in the early mid 2000s when all these partials went in. So we have a pretty good list of who they all are. And if you're on that list and you live in DC, you already know because we sent you a letter. I promise we did. So we kind of cheated and just pulled it right there and said, you know what, let's just pay, they all get a letter. And then our plan is to kind of keep repeating that. Like if you have one of these properties that we know is eligible for this assistance and we know has this pipe configuration that can be dangerous, we'll keep contacting you directly because we do know who you are. So that's been extremely helpful. But I love what you said about lack of trust. Honestly, that's so important. And I think here in DC especially, because DC Water and Sewer Authority did change their name after the kind of lead crisis in the mid 2000s to DC Water. So we do see that lack of trust is still a very real issue. And so even when you get a letter in the mail and it's still from the water utility, there can be a lack of trust there. So one thing we've done to kind of assist with that piece is anybody who lives in the district can get a free lead test kit. So that's one thing that can kind of provide some level of certainty, is like, here's kind of a scientific measure to look at hazards in your house, and that's something that's widely available here. So to try and overcome that barrier about connecting with maybe communities that have less trust.
Thank you all for sharing that. And also, just to plug something, was the 2020 and 2021 ambassadors are doing, we will have a Google Sheet that you can sign up to actually learn more about, how to eradicate lead, and we'll have contact information so your local health department can reach out to you if you do have any additional questions pertaining to lead-based paint or lead water. All right, so moving on, we're about to wrap up pretty soon. I do want to actually get you guys' opinion on this as well too. So with the lead contamination that we see going on in the world, how does that compare to other environmental issues or other social inequalities? How do they compare across the nation? So we see lead-based paint or lead exposure, or we see things like our overall water supply. So our sea levels, our oceans, and those types of things. How do those two things connect with one another?
Well, if I can start on that one, when the moment you asked that question, my first thought was, especially here in DC and other major metropolitan areas, is housing affordability is an extremely related issue to this problem. When there's not a lot of housing that you can even afford in the first place, whether or not it's the safest kind of housing is often the fourth or fifth thing that you're selecting. And it's just from necessity, you've got to have a roof over your head for you and your family. So I think it's very related to that issue. It may not be the ideal housing just because of what it costs. So that to me is we should think about that when we're thinking about who gets exposed to lead hazards and why.
Yes, absolutely.
Oh, you want to go? I was gonna just add another piece in there. We have another program with Black Millennials for Flint that is called the Flint EJ Griot program, and one of the things that we talked about is the interconnectedness of environmental issues. Specifically, one thing that I want to point out is about body burden. So when you think about, for example, in a place like Flint, Michigan, where I mean, from generations to come, we don't even know the impact yet of the Flint water crisis. So we're talking about issues that were pervasive from an environmental perspective with lead, but again, like also lead in housing. Again, those homes that were built before 1978. You also have to think about the impacts of climate. So specifically in Michigan, it's cold, but it's been real cold, right? Like insanely cold.
Yes.
And you think about also like extreme weather and how all of those things just come together and just, really become detrimental to the body. One quick thing that I like to always harp on is the impact or the intersection of lead poisoning, the climate crisis, other heavy metals that exist in our water, not just lead, PFAs, how that impacts childhood development, and also how it impacts women, particularly from a reproductive health and maternal health perspective. And then even with men, don't often talk about this a lot, but specifically with lead exposure, like your ability to be fertile, with consistent exposure becomes an issue. So to quickly answer your question, it is so interconnected, and you can't really talk about environmental justice from a silo. You have to successfully talk about it and address it from, I would say, the best framework from within the social determinants of health, and how all of these moving parts still work together, and it could either work against our greater good, or we could put forth a better effort to make those things better from a whole person perspective.
Yeah, I love what both of you have said, and I will add and maybe just connect the two thoughts that in many places around the country, there is a shortage of affordable, high quality units. And what that leads to is folks who are maybe on who maybe have a limited income occupying homes that are still unaffordable, but also contain substandard conditions that contain hazards like lead, like mold, like asbestos, those types of hazards. And so what that does is put people in a situation where they're having to navigate living in these conditions while still, making it to work, making it to school, wanting to succeed. And so the body burden is definitely a real issue when it comes to environmental injustice and when it comes to housing conditions. And to connect to another point that Latricia said, today happens to be Weatherization Day, and weatherization is a form of energy efficiency that promotes is a form of energy efficiency that essentially protects a building from the elements. So if it's cold inside, the cold air will stay inside and it won't leak, or vice versa. So in the context of the climate crisis, it's really important that we reduce the amount of energy that we use, as a country and as a population. And so one of the ways that we can do that is by making our homes more energy efficient. Unfortunately, before I get to that, there are programs available as well through your local utility, through federal government programs, through sometimes state programs, and DC has a wonderful law that maybe Mackenzie can talk about, but there are programs that are available to help people improve the energy efficiency of their homes. Unfortunately, not everyone is able to access all of these benefits because of the condition of the home. It happens far too often where you know, a household, a member of a household qualifies for a energy efficiency program. The utility will send someone out to the home. They'll do an inspection. They'll say, hey, you need a new boiler, and we can do some air sealing. We can put insulation in. But then they identify lead-based paint. They identify the presence of mold. There's a pest problem, which indicates that there are holes in the foundation. And because of those issues, the utility oftentimes doesn't have resources to address those issues. And so what they end up doing is deferring it indefinitely. They defer it until these issues can be addressed. And the one thing that we know about the households that often have these issues is that oftentimes they don't have the resource to address it. And so it ends up becoming deferred indefinitely. And so as we're thinking about lead, as we're thinking about housing conditions, it's important that we, again, think about it holistically so that we can improve overall the quality of housing that we all live in, and that we promote and advance a healthy, safe, affordable, energy efficient housing that, one, protects people from hazards, allows people to maximize what they want to do in life, and it also helps to protect our environment that, you know, as Latricia outlined, disproportionately, you know, these climate impacts also disproportionately impact, you know, low-income communities of color, indigenous communities. So it's really important that we look at housing holistically to address and protect people.
Absolutely, absolutely. And I'm looking. It looks like we do have a couple questions in the chat that I wanted to get to before we go. So the first question is, let me see, I believe it's posed for Mackenzie. Let me see. Okay, it says, let me see. Okay, so it says, are residents, especially children in DC public housing, being protected from ingesting lead in drinking water? And then what are the measures that are being applied? If not, why isn't lead-free bottled water being supplied to these residents while mitigation of sources is ongoing?
Absolutely. So to make sure that people are not currently ingesting lead, the primary measure for lead in drinking water is treatment within the water. That's the primary way to, because even if we took out every single pipe that we could in the city, there's still things like old solder and traces like this that can put particles into the water. So the number one line of defense is actually just the water treatment itself. The problem is that water treatment can fall short, like we saw in the early 2000s, if the kind of chemistry of your water changes. So scenarios like that is why with our water utilities made a commitment to replace all lead pipes in the district within 10 years. It's called Lead Free DC. So that is a plan that's hot off the shelf, brand new, but we're looking forward to doing that. So we're not just relying on the water treatment, but also just removing the source itself.
Okay, absolutely.
Yeah, I can add a little bit because I had the opportunity to work with the DC Public Housing Authority as they were proactively wanting to address lead hazards in their properties. And the housing authority a few years ago came under new management, and one of the first things that the new management wanted to do was look at the distribution of potential lead hazards in their property. So what they did was they did a full they did risk assessments on all of their properties, and for ones where they found lead, they did a deeper inspection and took the proper precautions to hire folks who were qualified to remove lead, relocated families if they, you know, if that needed to happen. But this came out of the fallout of what happened in New York City with the New York City Housing Authority, where for decades, occupants were exposed to lead, and the housing authority, because of lack of resources and maybe some other disinvestment and lack of attention paid to the hazards, were unable to address these lead hazards. So what the DC Housing Authority did was, when they became under new management, they took a look at where all of their housing stock was as it relates to lead, and did their due diligence to try to address those. I know that they tested water, and I know that they tested soil as well. I don't know if what happened after that as it relates to the water and the soil. I do know that for all lead-based paint hazards in the properties and on the external surfaces of the property, that those were addressed.
Okay. All right, and then it looks like we have about 2 more questions. It says, are energy assistance services available for apartments? It doesn't specify the area, but it just asks if those energy assistant or weatherization, I think that's what they mean, the weatherization efforts, is that available for apartments or just housing infrastructures?
It is in DC. I can't speak for all areas, but our weatherization assistance program, we will do single family, we will do a rental with sign off from the owner. We also have some pretty large multifamily projects where we tackle the whole building. So we will do all 3.
Okay.
Yeah, that's the case for most jurisdictions. The one sticky point is the having to get sign off from the property owner. Sometimes that can be really hard, and then the tenants end up having to deal with a really inefficient energy infrastructure in their home. So it's something that we have been trying hard to address, and try to make that that's called a split incentive, where the property owner has no incentive really to address this because it's not burdening them all that much. So we're working hard to try to address that, and there is not a clear good solution for it, but what we do know is that it is not fair for tenants to have to live in some of these conditions. So we're working hard to try to address that.
Okay, great. And then I see one more question in the chat. It's asking you guys to explain what is a full body burden. What does that entail?
I can take a stab at that. It is really, when you're exposed to a hazard like lead, the longer the exposure happens, and the more so lead, the primary mode of exposure is ingestion. You can inhale it as well, but the primary mode is through ingestion. So when kids are crawling on the floor, touching windows, and putting their hands in their mouths, that's where the majority of the exposure comes from. And the more exposure, the more lead that's ingested, obviously the amount of lead in the body builds up. And the way lead impacts the body is that it slows down your neurological development. And so when we're talking about full body burden, what we're really talking about is the impact of an exposure, and how the increased levels of ingestion of certain toxics can impact the entire body. And so it is something that is a concept that is meant to explain exposures over time. So as the exposure increases over time, you get more of a full body burden over time, and it's something that has been studied in the cases of there's something called the weathering hypothesis, where women who were essentially, this was a study that was conducted where researchers found that African American women were not carrying their babies to full term. And this comes back to what Latricia was saying earlier, when compared to non-African Americans, to white women. And so the hypothesis was that, you know, periods of racial discrimination was actually leading to that. And so over time, the more racial discrimination, or the more racism or discrimination that you're exposed to, the more stress that puts on the body, and the more likely you are to experience poor health outcomes. And so the outcome that was studied in that scenario was preterm birth and birth outcomes.
Wow.
I want to speak to really quickly to Rebecca's question surrounding the issue, and it kind of connects to blood lead testing, where if you are exposed to lead, it is deposited into your bones, after about 3 months or 90 days. And the question is, and it connects back to body burden. I know I have not personally experienced the actual procedure where you can actually have your bones examined to determine if there are deposits of heavy metals, specifically with lead. But I do think that there needs to, one, be more research surrounding that. Because if we really want to get to the heart of the matter of not just putting into place policies, not even doing like the remediation steps, if we don't acknowledge the fact that people who have already been exposed carry a legacy of toxins in their body, we really are not as progressive as we need to be. So I did want to acknowledge that. I know that is that's not answering the question, but I do think that there needs to be much more emphasis on that. I do think that there's quite a bit of emphasis on the screening component, specifically with children, but also being aware that we have people across the human spectrum that all are negatively impacted if they are exposed to lead. So just wanted to put that in there.
Thank you for that. And then before we sign off, there is one quick question that we wanted to pose to all our panelists. In terms of the challenges you see, we talked about the funding that's not there, and then actually the amount of people who are mobilized in the community. So not just, dropping things off one time, but actually staying consistent. We talked about those are two of the limitations that we have, or, challenges that we have in this fight against lead prevention. And then I just want you all to kind of talk about what other limitations do you see, either on the national, state, or local level, some things that people can start, moving the wheel more often and promoting these causes right in their own community. What can people start doing today? Because we know that the funding isn't there, but what can people, some things people can do today, they can take away from this conversation?
I'll start. So, I do think for us, for our program specifically, the biggest issue, it is the funding. Removing all of the lead pipes in the city is, back in the envelope calculation, probably about $1 billion. So it is a pretty hefty price tag to undertake that kind of removal. And it's not just DC, of course, it's every city with the kind of old infrastructure is in a really similar situation. So the funding is a major concern for us. What are some other issues? I think a lot of things that I've described in the last hour have indicated that we do kind of rely on data to be a major support for our operations, but the data can also be a problem in of itself. Information is just not perfect. Having just flawless perfect information would make, I think, everything we do much more of a breeze. But obviously for like service lines specifically, and also things like lead paint, you don't know what's inside someone's house and you don't know what's underground. So that can be difficult. Investment in knowledge is very important. What people can do right now. I think something that people could do right now is to know where they live, to test their house, to test their children. They need to know what their current situation is in regards to lead. And then also familiarize yourself with the resources of wherever you are. So in DC, like the free lead test kits, that's something that's incredibly helpful. Be aware of what water filters you can purchase for your house, things like that. So become familiar with your own risk too. So I think that's my right away. As soon as you get off the phone, you can find out some things like that.
Yeah, I'll go, and yeah, I'll also echo some of the things that I said earlier, which is, I think one of the reasons why lead is still an issue is because collectively, I think we've lost momentum and we've lost the interest of the broader public of this issue, and that in itself is an environmental justice issue. The fact that this is a health hazard that still exists today and is still impacting people today. And so what I've seen gaining traction is essentially, Joe, but you posed a question about the relationship between lead and other environmental health hazards. I really see that as a really good way of getting that momentum back. There are so many other environmental health issues that are occurring in communities today. And I mean, lead is really important, is very dangerous and negatively impacts children. But there are a lot of other issues as well that are impacting community, homelessness crisis. There's an energy affordability crisis. You're thinking about, like Latricia said, communities that are impacted by the climate crisis, that are dealing with fires, that are dealing with flooding, hurricanes, and so I really like to see a lot of advocates and parents, anyone, to start talking about lead in the context of some of these other issues. And if we're looking to address the climate crisis, I think lead should be in that conversation as well, because it is part of the conversation, like I said earlier. And thinking about lead in the context of housing conditions, I think is also really important as we're thinking about affordability, as we're thinking about quality, like Mackenzie said earlier. So, yeah, and I see a comment from Rebecca. You're right, lead isn't just a low income or a poor people problem. It occurs in I think that also, I think you're right, is definitely a misnomer. What I can say is that it disproportionately impacts those communities, but there are a lot of communities, middle income communities, that also suffer from or that are impacted by lead as well. And so that's why it's really important that we advocate for things like proactive rental inspection to make sure that every child is covered and that all properties are safe. That's why we have to make sure that sufficient testing, that every child is tested at the age of 1 and at the age of 2, to make sure that we are doing our due diligence to make sure that children are safe and children are ready to learn when they get to school. But you're right, Rebecca. I mean, this is an issue that impacts a lot of people, and if we are able to loop in lead with some of these other issues that are happening across our country that are in communities, then I think we'll be able to build that momentum back up.
All right, so we're over time. We will. It was getting good, right? It's so exciting that everyone stayed on a Friday night. So with the questions that came in, one of our best practices with Black Millennials for Flint is we distribute an FAQ following our virtual events. This is also recorded, so the video will be included there as well. I responded in the Q&A box if there were questions where we have a plethora of partners. I'm from the South, so I always say I know my ministry and I know other folks' ministries. So if there were questions that were not fully addressed in this panel, then we have some recommendations for other organizations that you can reach out to that can best get you to that point of clarity that works best for you. But we will wrap up here. I want to say thank you so much to Jamal, and also to Mackenzie, and of course to our tribe member, Joe, for being a phenomenal facilitator this evening. And shout out to, I know there's some other ambassadors that are on this evening. Thank you all for putting on such a wonderful virtual event. And so hopefully we will get out of this COVID situation soon so we can physically convene together. So thanks again and have a wonderful weekend. Bye.